The one thing about pain medicine, I think what's different about my practice then, is I actually listen to my patient. We spend probably a good hour with every new patient, so I get to sit and I listen to what's actually happening. Where is your pain? How is it affecting your life? And then I place my hands on you and we figure it out. And then we look at the x-rays and the tests that have been done, and we actually make a plan that fits that person, whether that's doing injections or medical management or sending them to a psychologist or psychiatrist or sending them to physical therapy or even to a surgeon. You can make that plan on an individual basis. They got to believe that you actually are hearing them. That's actually one of the biggest connections. You have to make that connection. As a pain doctor, again, we don't help everybody's pain. So you have to also get that person to get involved in their own health. I talk to patients about quitting smoking because smoking actually increases pain. I tell them to lose weight. I tell them how to lose weight. I tell them if they have emotional problems that we need to get them in to see a psychologist, that they need physical therapy. So you have to get a person to get involved in their own health. Otherwise, they're just not going to get better. So you got to get them to grip the entire thing. Hits you up the side of the head sometimes when getting a day older and a day more out of shape. So 2 years ago at 6'1", 275 pounds, I realized I wasn't going in the right direction. I wasn't doing the same things I was telling my patients to do. So at this point in time in my life, being 55, I've now lost 55 pounds. I'm now down to 220. I'm back to exercising, riding my bike. I was pre-diabetic. Now I don't have any diabetes in my body, so I'm not even taking medications that I had to a year ago. I believe that when you're doing this, you have to be able to express to patients how they fit in your life. I also use analogies that make it hit home as to why you need to do this. Why? So you always, when you're talking to a patient, you got to give them reason to believe that you're hearing them, and then you got to give it information back to them in a form that they can understand and they can relate to their own bodies. On each individual first visit, I'm spending probably 50 minutes to an hour with them, so I really get to see what their problem is and where they're going. On every follow-up, we do follow-ups, and we try to figure out, okay, did I get one pain problem solved? Do I have another one? Did we not get it done? And so if you come back and what in a lot of places should be a simple follow-up, if it's not working, I'll have to try to figure out what's wrong and how did I miss, or did I miss it, or is there something else happening that I need to work on? So you have to take each individual, whether you're operating on them or whether they're in your clinic, and you have to say, you're the most important person right now. And until you get to that point where, okay, this is all that I can do for you today, then you don't leave that room. I think my favorite thing about pain management is being able to try different things, come up with different ideas that may help that individual patient. As a pain management doctor, we don't fix everybody's pain. So what happens is with that chronic pain patient is you have to keep trying. You have to keep trying finding new things. So when you go to classes, you're learning whether it's acupuncture, whether it's chiropractic manipulations, or whether it's new techniques of surgery, or whether it's new products that are out there. You're always trying to learn and find something that may help that one patient that you couldn't get better, so that you can add that one trick to your back bag that maybe the next person comes in that you can say, okay, I got this new idea that maybe it'll help you too.